Hello, beautiful people. So today I'd like to discuss about diabetes. Diabetes mellitus is not just about high sugar. It is a complete metabolic disorder that affects the body's ability to use glucose properly. And if in simple Urdu I'd say that खून में sugar का level ज़्यादा हो जाना because insulin is not working properly. So if diabetes is not in control, it would increase the risk of heart disease or kidney failure or blindness, nerve damage, or even stroke. But the good news is that if we just keep our lifestyle in a proper manner with healthy habits, we can easily manage with diabetes. Now, what is diabetes? Our body converts food into glucose, which is the main source of energy, and the pancreas produces a hormone which is to be called insulin. With glucose, this insulin adds up to give the energy for cells, and insulin helps glucose to enter the cells. In diabetes, या तो इंसुलिन बनता ही नहीं और या बॉडी उस इंसुलिन को प्रॉपरली यूज नहीं कर पाती, एंड द रिजल्ट वुड बी शुगर ब्लड में जमा होने लगती है, and because of this reason blood sugar would go up to a dangerous higher level of increasing the different sort of health risks. And if I say types of diabetes, type 1 diabetes occurs when the immune system attacks the insulin producing cells in the pancreas, and इस type में body insulin बनाना almost बंद कर देती है, या little और या बिल्कुल भी नहीं. So usually it happens in children or teenagers. Common symptoms would be like excessive thirst or rapid weight loss or fatigue or frequent urination, meaning प्यास लगना और कमजोरी or repeatedly going to the bathroom. Type 2 diabetes is the most common type actually, and in this condition body insulin तो बनाती है but cells insulin को proper respond नहीं करते. इसे insulin resistance भी कहते हैं, and the main cause would be or causes would be sort of obesity or unhealthy diet or lack of exercise, stress or family history as well. Even though आजकल के young people में भी type 2 diabetes is rapidly increasing because of the sort of junk food or soft drinks or having a sedentary lifestyle. Then there is another sort of diabetes I'd like to talk about, gestational diabetes, and that gestational diabetes occurs during pregnancy. प्रेगनेंसी के hormones कभी कभार इंसुलिन को अफेक्ट करते हैं, and usually डिलीवरी के बाद इम्प्रूव तो हो जाते हैं, but फ्यूचर में then type 2 diabetes के रिस्क इंक्रीज हो जाते हैं. As I mentioned that before, and some common symptoms include excessive thirst, frequent urination, blurred vision, tiredness and slow wound healing, numbness in hands and feet, and increased hunger. So if I say, or a question, why is diabetes dangerous? Many people think that to reduce sugar, they are finding out a solution. But diabetes is much more serious in long term because if uncontrollable diabetes can damage, like as I mentioned that before, would increase the risk of heart attacks or kidney failures or blurred vision or nerves damage. Now, if I say for food, particularly this thing also related to food, the food, sort of food which we are consuming. So the food to avoid actually, to reduce the risk of diabetes would be first thing would come in mind that sugary drinks, to avoid sugary drinks like soft drinks, packaged juices or energy drinks. ये blood sugar को quickly spike करते हैं. Then reduction of white bread and refined flour, meaning white bread or pastries or cakes or biscuits. So because these food items contain refined carbohydrates, so we have to reduce refined carbohydrates as well. Then you have to reduce fried foods. Let's say, for example, fries, chips or fried chicken, because excess oil increase the insulin resistance, meaning इसको worse करता है. Excess sweets like candies, chocolates or desserts, we have to reduce it. And processed food, especially instant noodles, or processed snacks, fast food, are highly dangerous, and increasing the chances of diabetes. जितना ज़्यादा processed और artificial food होगा, उतना ही diabetes के risk ज़्यादा बढ़ेंगे. Now, if I say, best foods for diabetes, what you should consume that you can control your diabetes, you should eat lots of vegetables. Let's, for example, spinach or broccoli or cucumber or bitter gourd as well. करेला स्पेशली ब्लड शुगर को कंट्रोल करने में बहुत हेल्पफुल होता है. Then if I say whole grains like oats or brown rice or whole wheat, meaning choker would be added up also in that wheat flour. So then protein sources, of course, like eggs or fish. Chicks are a good source of high protein. Low protein in lentils, you can also say. And then healthy fats such as nuts, olive oil or avocado. Then fruits in moderation. You have to take like apples or berries or guava, but make sure that high sugary fruits, excessive quantity avoid karni chahiye, because then they are not good for that could increase the chances of diabetes as well. So now if I say the role of exercise here in diabetes, so exercise is a sort of powerful natural medicine for diabetes. If you just do walking, cycling, swimming or light jogging, so it improve insulin sensitivity as well. Expert recommend 30 minutes walk भी blood sugar को control करता है. 30 minutes exercise or 1 hour walk is also good for health. Now, how would be diabetes diagnosed? So one important test is there for diabetes to check is HbA1c. If it is greater or equal to 6.5%, that means you have diabetes, and this shows the average blood sugar level over the last 3 months. Now, how to prevent type 2 diabetes? Some sort of prevention tips I'd like to give you here is maintain healthy weight, avoid sugary drinks, stay physically active, sleep properly, reduce stress, and of course the last thing for especially men is stop smoking. A healthy lifestyle ही actually diabetes के लिए एक sort of a shield है. My final message is to remember that healthy food is a medicine. So consume your food as a medicine. Exercise is a powerful therapy for diabetes, and early diagnosis save our lives. So अपनी health को ignore ना करें और regular checkups करवाएं with that balanced lifestyle को adapt करें. And if you found this video informative, so please like and subscribe my channel, and I'll see you guys soon. Bye bye.